Hi, everyone. My name is Archita Desai. I'm an assistant professor at Indiana University in the School of Medicine and Division of Gastroenterology and Hepatology. I'm excited to share with you a summary of an article entitled Multidisciplinary Pathway to Support Lifestyle Change, the Tangible Benefits in Physical and Mental Health for Patients with Non-Alcoholic Fatty Liver Disease. I'm joined by Ms. Mary McCallum. She's a health psychologist for the National Health Service and is pursuing a PhD. She works at the Adult Weight Management Services at the South Tower Aberdeen Infirmary in Scotland. Mrs. McCallum, it's great to be joined by you. So please tell us, how does your paper add to the knowledge we have about supporting lifestyle modifications such as weight loss and increased exercise in individuals with non-alcoholic fatty liver disease?
Thanks for inviting me. It adds to the knowledge because we know that NAFLD is strongly associated with obesity, hyperglycemia, high insulin levels, and high levels of fat in the blood. We also know that lifestyle management aimed at weight loss is one of the clinical, the mainstay of clinical management guidelines for NAFLD. However, we understand that it's very difficult for people to actually change their behavior. Patients report having tried and failed many times and needing more support than just advice and information alone. So our paper describes a holistic approach to supporting self-management and the tools that we use to help patients develop confidence to make lifestyle changes.
Yes, all very true. Could you describe your clinical setting and your research methods?
Yeah. So I work in a busy outpatient hospital clinic in the northeast of Scotland. And like many clinics, we had long waiting lists of patients waiting to be seen. So we established a new multidisciplinary pathway with input from psychology, liver nurse specialists, and dietitians. And in this pathway, we aim to embed lifestyle management support as part of routine care. So each patient was seen by a liver nurse for a fibre scan and systematically assessed for cardiovascular risk factors. Each patient was seen by me, a health psychologist, and I used a motivational interviewing approach to evoke patients' own reasons for making changes, specifically asking what they wanted to change, what they felt they could change, and what they wanted to be different in 6 months' time. And we referred them to speak with a dietitian for specific dietary advice if required. And then I developed a tailored plan with each of the patients and provided follow-up on average 4 times over a 12-week period for support, motivation, and relapse prevention.
That's an amazing pathway. So tell us, what were the results as you had that intense intervention?
We had some good results. Our pathway showed initial improvements in liver and cardiovascular outcomes. We didn't see a significant change in weight loss. However, we did see significant improvements in physical activity levels, most notably daily step count, and significant decreases in FibroScan scores and anxiety and depression scores and fasting blood glucose. So what we conclude is the benefits of increasing physical activity alone, even without associated weight loss, shouldn't be underestimated. We also conclude that this is a really important area and would merit further research to look at what actually works in routine care and support our patients with NAFLD to make and sustain lifestyle change.
Absolutely. Well, thank you for joining us. We hope the readers will take a closer look at your manuscript and be able to take away some changes in their own NAFLD clinics. Thank you.
Thanks so much for listening. Thanks for having me.